Hi, my name is Kayla Roberts. I'm a sophomore at Miami University, and I'm here today to talk to you about something you may be familiar with, being broke. As college students, we have an obligation to our studies, which means less time for jobs and more time for school, right? Our days are filled with exams and research papers, and our nights are filled with waiting tables, running cash registers, mopping floors. But we do this in the hope that we'll graduate and obtain meaningful employment, right? But let me ask you this. What about those people that get stuck there? Those people that are working 40 hours a week at an hourly rate that equates to like a good cup of coffee and a bagel. I want you to imagine yourself in this situation. Imagine the field that you want to work in just doesn't have available jobs for you. You need to earn money to survive, right? A lot of you may have family that would help out, but what if you don't? You would need enough income to fulfill your basic needs, like keeping a roof over your head, keeping your belly full, keeping yourself healthy. So you have to take an entry level job and you hope, maybe you'll get promoted or you'll do this temporarily until you find something that pays better. So this company starts you out at the federal minimum wage level. It's $7.25 an hour. Now, if you're working 40 hours a week at $7.25 an hour, this would be $1,160 a month. Now, consider your rent, consider your utilities, your healthcare premiums, your transportation costs, and then groceries on top of that. Making ends meet would be a stretch. Now consider you had to save up for an emergency, your car breaks down or a huge medical bill comes into play. Could you do that on just over $1,000 a month? And this would also assume that you don't take any time off ever. Could you do it? Could you thrive? Unfortunately, this is the case for many Americans. Poverty in America as of 2021 is outlined at $12,880 per year for an individual. And as of the 2020 census, 37.2 million people, that's 11% of the population, live in poverty. So before we even consider taxes, working at $7.25 an hour equates to $13,920 a year. So needless to say, working at minimum wage is a guarantee that you will be living under poverty. So let's talk about how minimum wage started. It began in 1938 as a way to ensure that those who are working were paid fairly for their labor. This helped to prevent exploitation. And even back then, people understood that the minimum wage needed to reflect the cost of living. And this is the dollar value of minimum wage throughout the decades since its creation. As you can see, down in here in the 1970s, this is when it hit the highest dollar value. So even though it was below $2 an hour, real-time spending as per, inflation in the economy at the time was well over $12 an hour. Now, if you look to the current standpoint, the dollar value is parallel, like in line with what that means for inflation. So basically, people who are making minimum wage do not have the spending power that they did decades ago. So who makes minimum wage? I know a lot of people are immediately going to go to the restaurant industry, and that is one of the highest at or below minimum wage jobs, but it goes so much farther than that. I mean, you can look at the chart here, but the one that I would like to talk about the most is healthcare support. Now, in an industry like healthcare, which is insanely profitable to begin with, but also it was deemed a very crucial industry to be a part of when the pandemic happened. Now, according to this quote that I found, nearly 5% of all of the people living in poverty in the United States are healthcare workers or their children. And personally, that just doesn't seem right to me. If you're in an industry that has been labeled as essential, you shouldn't be struggling to survive. You're providing a service that people have deemed important for the survival of the human species. So poverty is more than just not having money. I mean, it's access to your food, it's access to housing, it's access to transportation, education, healthcare, mental health resources. So let's talk poverty and education. Kids who come from impoverished homes are typically less likely to be school ready than kids who don't. There's a lot of varying effects that you can see on the slide, but one of the biggest things that I want to talk about is the lack of support system. A lot of times when parents are working minimum wage jobs, this requires long hours, or this requires a second job, keeping them away from their home. This bred a tendency or a type of, term called latchkey kids. So latchkey kids are the kids who are coming home from school by themselves. They're in charge of taking care of themselves. They're in charge of making sure that their homework is done. They lack parental supervision in most cases. So the problem with having kids basically raising themselves is you're going to see lower academic performance. You're going to see all kinds of mental effects like depression. And this can also lead kids into participating in criminal behavior and getting, mixed in with the wrong crowd. And eventually that could lead to incarceration. So 2/3 of people in jail prior to being arrested report incomes of under $12,000 a year. So 2/3 of the people who are in jail come from a situation of poverty. And then after they're incarcerated and they get out, not only are they returning to poverty, but they have the added struggles of the employment barriers from having a record. They have criminal debt and fees and fines and lawyer costs that they have to pay off. And then if you are accused of a felony, this can also hinder your ability to obtain public benefits, like welfare or SNAP, things like that. So you kind of get into this never-ending cycle. Now, looking into one of the things that I had mentioned earlier, healthcare, poverty directly affects your healthcare. Not only does it limit your ability to purchase nutritious food, you have to think about the cost of healthcare premiums as well. So the average cost of an individual health insurance policy on a national basis is $456 a month. That's just for an individual, not a family. So on top of that $456 a month that's supposed to be coming out of your $1,100 a month that you make on minimum wage, you are also responsible for deductibles and copays. Now, some of those can be $30 every time you go to the doctor for an office visit, but some of them are you're paying 20% of any procedure that you have done. And when you're talking, thousands of dollars for a procedure, that can add up, and it can add up very quickly. So what do some of those look like without insurance? Now, I won't read through all of these either, but if you take a look, just one appointment at a psychiatrist could cost you upwards of $160 if you do not have insurance. And when you're talking poverty, one of the biggest factors of poverty internally, I guess, is the strain that it puts on your mental health. Now, if your appointment is going to cost you $160 and you feel you need counseling services, say on a weekly or even monthly basis, I mean, it's unattainable. It's completely unattainable for somebody working minimum wage without health insurance to maintain adequate counseling services. So what can we do? I mean, real change has to come from above. There has to be some kind of mandate. There has to be some kind of change in official procedure nationwide in order to at least combat generational poverty, because this really is a cycle. And the common terminology of this bootstrap mentality just doesn't work. You can work as hard as you'd like, but if you don't have the resources to achieve, you're not going to. So there are some cities across the country that have instated a city level minimum wage. A lot of places have done $15 an hour. Some have done more, but some of the major cities that have done it are San Francisco, Seattle, Los Angeles, Washington, D.C. And within that, they have found that it has not had a huge impact on employment prospects, and it's very good at strengthening employee retention. So this can help cut down the cost of training new employees, and you have better morale, you have better loyalty to the company, but this does come with some problems as well. So if you have just one city that has, say, increased their minimum wage to $15 an hour, what's stopping a business from outsourcing all of its production to a neighboring city? So the workers who could potentially be making $15 an hour at this company are either forced to find another job or to work where the company moves and take a lower wage. Another issue that could arise with something like this is workers are going to commute to a city where the minimum wage is higher. If it's only a 20-minute drive to get to somewhere where you could make $15 an hour, why would you stay at a company locally that's only paying you $7.25? So in order to kind of combat this, with the boundaries being so fluid, it needs to be a nationwide venture. You can't raise it in one area and have it stagnant in another and expect it to balance. So COVID is actually the silver lining of COVID, I guess you could say, is the fact that people are kind of realizing that if they don't participate in this mechanism, then real change can happen. Everybody, I've heard it 1,000 times, and I'm sure you have too, but there's this ongoing, I guess, mantra that people just don't want to work anymore. And I don't think that's the case. People don't want to work under conditions that are completely unfair. People don't want to work their lives away and still not be able to survive or even live comfortably. So low-wage workers after the pandemic have dropped out of the workforce at staggering rates. So a lot of bigger companies are kind of reevaluating their wage levels and hiring processes. I know Amazon they raised their minimum entry-level wage to $15 an hour, and they're currently pushing for the nationwide increase to $15. Bank of America is another company that has pushed to get employees in the door, and they're starting out at $25 an hour nationwide. Costco was another one that upped their minimum wage. But what can we do? I mean, we're college students, so we're young, we don't have a lot of power in the grand scheme of things. I mean, there's always the option of writing to your representative. That's always a thing that you can do, but also we can apply to internships. We're in this kind of position where we can go into these fields and, get a feel for how they work, and you can put yourself in front of people who can actually make change right now. But bigger than that, we're on this venture to go out and find ourselves and find our career and find our place in the world. And especially if you're talking a political science major, like, this is where you're going. You're going into politics. So you can build your entire career around knowing that working full-time, no matter what your position is, working full-time should produce enough income to support yourself. And then, I guess in a final sense, you can also be conscious of the jobs that you take. It may be hard, it may be a struggle at times, but if you do not take a job at minimum wage, and everyone refuses to take a job at what the minimum wage is right now, we force these companies to up their game. And this is kind of what's happening right now. So hopefully it continues.